allow cervical cancer checks. Cesarean, did you know that a cesarean is the cause of a pre-existing condition for many insurance companies? That will be struck out. But of course, our man Paul Broun wants it, and he voted against this. And finally, premiums for women are higher than men, and that will be, the new bill, that's gone. He voted against nursing home regulation. There's a tremendous amount of, in the bill about nursing homes and their regulation, and we know how important that is today. Anybody who's had an elderly person go into a nursing home crosses their fingers, but the government will regulate that now, and that he voted against that. The donut, when you have Advantage D and you you go up to $2,500 and then you pay all for your prescriptions all until $5,000, that's being cut back by $500 and eventually be phased out in this bill. Mr. Broun voted against it. Did you know that dependents no longer have to find their own health insurance after they're 18? That this bill provides for them up to the age of 26, and Paul Broun voted against that. There's no lifetime cutoff in this bill. In other words, you can't suddenly say, well, you've used up all the money now and you don't have any insurance anymore. That's gone. The Senate bill is a bill that will save money and reduce debt. It's $890 billion, but over 10 years. But the way it's structured, the health care, which keeps going up and up and up, cost will bend, and that is something that our conservative friend Paul Broun will no doubt vote against. Let me talk about Medicare and myths. The myth in Medicare is, oh, we cut out Medicare, we're cutting out a lot of Medicare in order to pay for this bill. No, what they're cutting out in the Senate tonight, as a matter of fact, was the Advantage D, Medicare and Advantage Medicare D, which is nothing to do with Medicare, except we subsidize people to buy private insurance with that. And according to most physicians, it's a horrible situation. And the Senate tonight has an amendment, or maybe they've done it already, I think, have cut that out. It doesn't touch any other aspect of Medicare. So that's a myth that Medicare is going to be injured. Older Americans will keep their doctor. Another pre-existing condition by the insurance companies was domestic violence. If your spouse was somebody who would beat you up, you are not eligible for health insurance. Can you believe that? But that's gone now. You haven't heard about congenital deformities. Children who are born with deformities. And because of that, it's a pre-existing condition, the health insurance won't insure you. That's gone. There will be insurance under this bill. Mental health and drug abuse is covered. End-of-life education. This is hysterical. I went to my doctor, I said, would you tell me how to end my life? He said, no, that's not right, there's something wrong. I said, well, that's about the Republicans are telling me, that if I go to you, tell me how to end my life. The fact is that everybody, as we know, needs end-of-life counseling in terms of what you want. For example, do you want the respirator to be pulled? Do you want to keep it on? Things of that nature. And all this bill says is that and it uses this word, it's completely voluntary for you to go to your physician, completely voluntary. and work out what you want in the end of your life. But that was, of course, that they were going to end your life, the physicians. Finally, along with what we've heard, and along with the nursing regulation, is hospital regulation. Hospital regulation. The hospitals are going to have to report the number of infections they've had, the number of successes they've had, or failures they've had with heart surgery or with surgery in general. So this is a real healthcare reform bill. Now, it's obvious that it's not going to stay in this form, but with the Senate, which is even a better bill because of the bending of the curve to reduce cost, I think we're going to have a great bill. But we've got a guy here who says no, no, no. We've got to confront him and say yes, yes, yes. Thank you.